As nationwide coronavirus cases now top 3 million, Texas is also reporting its worst day for hospitalizations and deaths. And right now, there are just over 1,000 available ICU beds. Our next guest is an emergency physician in Houston and knows firsthand how dire the situation is. Joining me live, President of the Texas Medical Association, Dr. Diana Feit. Good morning, doctor. Thank you so much for coming on and for all you are doing to help fight this virus. At this point, are you concerned that Texas is going to run out of hospital beds?
We do get concerned at times like this. We had a lot of practice over March and April where a lot of hospital beds were developed, such as opening up a large stadium in Houston and making it into hospital beds. That was shut down because we didn't need it after all. Now that we've got so many cases coming up, at least a lot of the patients now are younger and not quite as sick, but because of the volume, we have a lot of very sick people too. So we may have to go to the next phase of opening up something like a stadium.
Oh, wow. Have you been able to nail down why there is such a significant spike? Do you chalk it up to people just getting a little bit complacent and not wearing masks anymore?
Texans were really good in March and April about socially distancing, staying at home, wearing masks, things like that. And then once things opened up a lot more, beginning about May 1st, and then especially once Memorial Day hit, people did get out more and more. You would see pictures of crowds, people standing shoulder to shoulder, not wearing masks. It seemed to deteriorate at that point.
Yeah, it appears to be adding up. Well, here is the mayor of Houston on his concerns. Take a listen.
If we don't get our hands around this virus quickly, in about 2 weeks, our hospital system could be in serious trouble. The coronavirus is continuing to spread in our city, and collectively we have to do everything that we can, working together in order to slow the progression.
Okay, so that's the mayor. Now, the governor has issued a mask mandate. He shut down bars. He put restrictions on restaurants. Some people in Texas say that that goes too far. Others say it doesn't go far enough. Where do you stand on that?
Well, as physicians, we hope people will just start to even harder to follow our recommendations, particularly staying at home, and especially if they're over 65 or have chronic illnesses, but paying attention to social distancing and masking and washing hands, avoiding large events, those type of things. That's why we made up a list to try to delineate an order of what's the riskiest type of things to participate in and what are the least type of risky things to participate in, so people would get, a better feeling for that type of thing.
You know, you just brought me to this list that I think is such a great idea. And the Texas Medical Association, which you are the president of, released it. So thank you for that. It does show activities that are, the highest risk, like eating at a buffet, working out at a gym, going to a bar, considered the absolute highest, and also lower scale activities like opening mail and, getting takeout, pumping gas, that sort of thing. Tell me a little bit about how you came up with this list and why you think it will be so helpful for people to take a deeper dive at these different activities.
Our Texas Medical Association has a COVID task force made up of many physicians who are epidemiologists, public health physicians, infectious disease specialists, people like that, and together with the Committee on Infectious Disease. And we picked out several activities, actually quite a few activities, that we thought Texans would participate in the summertime. So it was actually designed for Texans, and it was made for Texas physicians to help their patients understand the ratings of these activities. So this group of expert physicians got together. They were assigned to look at 5 factors that were involved in all these activities, such as is the activity something that's on the inside or on the outside where there's plenty of room for the virus to dissipate into the air, so to speak. How close is everyone to each other? What length of time are we talking about an activity? Just a few minutes or hours? Likelihood of compliance is an activity where people are going to pay attention to social distancing and wearing masks. And personal risk level, is it an activity with teenagers and young 20-year-olds who aren't going to get as sick, or with older people who are at more risk.
Well, it makes a whole
And
lot of
that's how they
sense.
rate it.
Absolutely. But it is helpful to see it all laid out the way that you guys did. Doctor, you're fighting the good fight, and we thank you for it. Thanks for coming on this morning. We appreciate it.
Thank you.